This is like don't get good at things that you really don't want to be good at and don't want to do, so it actually works out well for me. So I'm playing Eric Olson right now, because Eric Olson had a baby, or his wife had a baby, but they have a new baby. So he was just on the schedule as Olson, so we're not really sure exactly what he was going to talk about. So we thought that we would throw in something that we don't get a lot of exposure to, and even though this event was a long time ago now, we're really talking like 8 or 9 years down the line from Katrina. There's pretty cool lessons that I think we can come out of this. And so I'm going to talk about my experience with deployment to Katrina and how it applies right now still to your own life in the ED and to disaster medicine in general, and maybe give you a flavor of some other stuff you can get involved in with disaster response and disaster medicine, and how it applies kind of more generally too with like mass care and mass gatherings and stuff. So the stuff that we're talking about here is not an official presentation about anybody. I've given this talk sort of officially before. But so to back up, people kind of generally remember Katrina, but it's like not the most recent big storm anymore. So like now Sandy is like the most recent big storm, and I'll show you some data about that later. But this is a region that is used to having big storms. We have some people that are like went to med school in Tulane, and they're not really here right now. Are there any other like New Orleans people around? Nobody's actually here today. We've got a couple people that have like local connections to the hurricane region. So to back up and remember about the lead up to Katrina, there was a storm sort of brewing late in the hurricane season. This was sort of the 2005 hurricane season. There was a big concern that this storm was leading up to be a direct hit on the city of New Orleans, and the projection, so this was from the 28th, this was when it was out still in the Gulf, the projection was there's going to be like a direct hit right on New Orleans at Category 5 strength. And so there was a big time lead up to this is going to be a big problem. However, and as everybody sort of recalls, and the reason that Katrina is stuck in our mind is like a big failure is, and as the actual, this is the congressional report, is actually titled a failure of initiative, because we didn't have, at the federal level, the state level, the local level, we didn't really have a good response plan set up for this. And as a result, there were 1 million people displaced and thousands of deaths, and like a really significant problem. And it still remains the most expensive and the highest toll in terms of death of storms in American history. So the concern leading up to this was still pretty alarming, and people still were trying to scramble to prepare for this. And despite all of that, there still sort of was this big failure of response. So within a couple of days later, so at the time that I showed you that graphic with the projection that it was going to be a direct hit at Category 5 strain, there was actually evacuation orders in place for New Orleans and a lot of the surrounding coastal communities for a long time leading up to that. The plan was to have New Orleans evacuated before there was even really a significant chance of landfall, even if it turned out not to be as bad as people thought it was. And so at the time that infographic was published on the Weather Channel, there was already a big evacuation underway. And by the 28th of August, they had opened a Superdome in New Orleans, and this is like the famous site that we'll kind of get into. as the refuge of last resort for the people that already had stayed and already had either refused to evacuate or couldn't evacuate for various reasons. And a lot of the problem with the general evacuation plan was that it didn't account for people that had medical needs and people that had mobility problems and for how to get out if you didn't have a vehicle. And so they actually pre-deployed a number of disaster medical teams to New Orleans Airport days in advance of the storm making landfall. So there actually was some planning that went into this and some pre-push of resources. And a disaster medical team that went to the Superdome to get ready for this refuge of last resort kind of setup. So I'm not even going to talk about the hospitals and stuff in New Orleans. There's really fascinating stuff that happened. There's a book called 5 Days Inside Memorial that is a really interesting read or interesting listen to an audiobook if you're interested in this. There's some familiar names that we hear about, like Tenet Healthcare Corporation. There are very interesting stories about the specifics that happen inside the hospital. In one hospital, and there's dozens of other stories that are like that in terms of the effect of a major infrastructure disruption on a hospital. And you guys saw it here like 2 days ago, right? Like there are emails that went in. Did you guys see the pictures of EDs around the city? And there was an email that came from Joe Mulaney, the DMC CEO, recently talking about some of the response that they experienced at Sinai Grace when like 3 other EDs around the area of Grace shut down because of flooding. This is like 2 days ago or 3 days ago in your city. And so there's major infrastructure disruption that causes really serious repercussions for healthcare. And so Grace saw an enormous surge in their patient volume because they had to take the ED volumes of 3 other EDs in their area over the course of an evening. And so this is over the course of a few days, and so this is a really significant issue. So there actually was lead up to this. And so to back up a second and give you a little bit more flavor of what's happening at the federal level as the lead up to this storm. So there's disaster medical teams that are stationed all around the country. Most states have at least one. There's a couple that have a couple large states, or a couple larger teams. Joe's pointing to me looking very bored in the corner over here. The Disaster Medical Assistance Team, DMAT, is the structure of most of the federal disaster response assets. So what these are, they're teams, they're about 60 people. It's all walks of health professions, physicians, nurses, PAs, NPs, pharmacists, veterinarians, the logistics people, supply people, technicians that do all sorts of work, a lot of EMS providers. And so there's a huge group of teams, and they come with all of their medical equipment and with all the support infrastructure to support themselves, to feed themselves, and to have sleeping quarters, and to have a portable patient care system that can go out and get deployed to anywhere and then operate independently. The idea being to operate independently for the first 72 hours and then be able to accept a resupply for both the medical equipment and for the support for the people, to be able to do a sustained operation for 2 weeks, 2-week blocks, and then rotate people and rotate equipment. And so there's teams all over the country. They deployed almost all of them as part of the Katrina response. So I was part of the Colorado 2 DMAT. There actually isn't a Colorado 1. I don't know why we're called Colorado 2. So the interesting thing about our team, and we'll get into this in a minute, sort of how it played into this, is that we're actually a dual rostered team. The NMRT is National Medical Response Team, which is an innocuous sounding name that's code for the Weapons of Mass Destruction Group. And so the NMRTs, there's 3 NMRTs, and they've actually since been wrapped up into the National Guard now, and so they're not using a civilian response force for this. At the time, and actually up until 2 years ago, there was this set of 3 national medical response teams. So the idea was this is a group of the same sort of group of people, or same sort of collection of a spectrum of people with some hazmat expertise and equipment to be able to respond to weapons of mass destruction incidents, nuclear, chemical, biological weapon stuff. And so we had the equipment and capability to do both of those and to bring both of those teams. So we actually got deployed as 2 groups of 60 people for this team to be able to bring a bunch more people and a bunch more equipment that in addition to what the standard DMATs have. So the NMRTs are set up pre-staged, a bunch of equipment for the sort of weapons of mass destruction kind of stuff. And if you think about it, this actually, we didn't think about it at the time, but it turned out to be useful because all the like sewage and nasty floodwater and all that stuff, was anybody working like with the flooding recently? Did you have people come in with like lacerations and nasty stuff? I worked overnight and had like a number of people that came with like puncture wounds on their feet and stuff from wandering around in floodwater, and it's nasty. We saw some weird infections over the course of the deployment, but this actually, that's a hazardous material situation, sort of. And so it turned out that it was actually kind of useful to have the hazmat capability. So these teams, the NMRT, the central team is the airborne team, so everything is sort of pre-staged in these aircraft containers and then pre-staged in a fleet of 6 semi-trucks. The containers can roll off and you can roll them onto a wide-body cargo jet and kind of deploy anywhere relatively quickly. And then the DMATs have all kinds of stuff stored in these sort of things, like bottled water and every other medical supply you can think of. And so the lead up to this was getting a bunch of people and all of their gear and all of the DMAT gear ready to go. And this was happening around the country times 15 different places that were kind of getting their DMATs ready to go within a number of days prior to the storm actually making landfall. Second landfall, it actually touched like the tip of Florida the first time, but like the big landfall was the second landfall. So all this initially, at the time of Katrina, this is one of the things that came out of post-Katrina analysis, the initial deployment plan for sending federal disaster assets into disaster areas was, well, they can just rent some trucks, or rent some cars, or rent some something, and we'll have a public-private partnership and be able to deploy all of this stuff. And so we rented a bunch of semi-trucks. It's actually pretty hard to do. And the new response plan is actually that the DMATs have these trucks that are like the delivery trucks for Coke and beer and stuff. And so they've loaded them up with all their gear. And that's actually sort of the new response plan. It's actually the response to like Hurricane Rita pretty shortly afterwards. And Hurricane Sandy has sort of been in this new response plan. So we loaded all this stuff. And meanwhile, there was a lot of stuff brewing sort of at the Superdome. And so this, as I said, was sort of the refuge of last resort. Over the next couple of days, and here was the failure initiative, one of the major failures. Over the next couple of days, we had all this stuff ready to go. All around the country, all these teams are ready to go. But nobody actually went. And so we waited until something hit. It was like, we want to see where it hits, we want to see how bad it is. And that was part of the issue. So they pre-staged a couple teams, but nobody actually really deployed anywhere. And so the storm moved through, and part of that is they didn't want to disrupt the infrastructure of the teams when the teams got there and have the teams get wiped out by a storm, which makes sense. But there wasn't a lot of pre-staging enough to get people in the right place at the right time to be able to respond. So this is what it looked like right after the storm ran through downtown New Orleans. With the Superdome right here and sort of the surrounding complex. It's interesting, I had an opportunity to go to New Orleans for a conference relatively recently and got to kind of drive by this site for the first time, and I'd never seen it, but post-Katrina, and there's still some remnants of Katrina in downtown New Orleans. And this is sort of what was happening in downtown New Orleans outside the Superdome. So inside, people had sort of set up a shelter that was, it's very loose to call it a shelter probably because there was no formalized structure. It was just a place and they opened the doors and said, come on in. And so people brought stuff from their houses. They basically packed up all the belongings they could think of. Most of them brought some kind of weapons because they didn't know what was going to happen. And they kind of rolled into this place and kind of duked it out to figure out space. There were really not opportunities to have bathroom facilities that were working longer than about 12 hours because this Superdome was designed for like, a ball game, right? And so it's really not set up to be like a mass housing option for people. And so it really kind of deteriorated very quickly into something like this. That's a really terrible picture. Sorry, it doesn't project very well. So the day after the storm hit, the governor of Louisiana ordered the evacuation of the Superdome, and they actually did deploy all the federal resources sort of the day after. So we got our deployment orders at night. We sort of drove out. It took about 24 hours, kind of like stopped along the way. Once we drove continuously, but stopped along the way for like the big trucker burger and stuff on the way, and made it down. Meanwhile, all of stuff is continuing to really deteriorate a whole lot inside New Orleans and around the Superdome. The National Guard, the Louisiana National Guard, had been able to secure some parts of the Superdome complex. There was still a lot of looting and crime and violence happening around the outside of the facility and definitely around the town, as you heard. Lots of, there's high-profile police shootings, all kind of stuff that still is being litigated, but almost 10 years later. But even inside the Superdome, there was a lot of trouble brewing, and part of the trouble that people were running into is there was violence against relief workers that were starting to come in. And so one of the major issues as we were in transit and about to sort of arrive in, initially the plan was to go to Baton Rouge and then go to New Orleans. We actually got diverted, I'll tell you about in a minute. But there was a lot of concern that the large convoy of semi-trucks full of supplies and equipment was going to be a good target for people, because people were hijacking small shipments of relief and sort of distributing it to themselves and to their friends. And it was really sort of becoming a big issue. There were rumors that didn't actually end up being substantiated, like relief workers getting kidnapped and being held for ransom and stuff. But there definitely were cases of hijacking of relief equipment. And so when we got almost down to the Louisiana border, we got diverted back over to Texas, because the idea was the Superdome was going to be evacuated and all these people were going to have to go somewhere. And the state of Texas sort of accepted them and said, send everyone in the Superdome to us in Houston and we'll take them at the Astrodome and we'll just move them to a different dome and see if that works any better. But now we'll at least be prepared for them. And so they diverted us to go and be the medical team to support the Astrodome as people were arriving there. But there was this concern that all these people that were involved in this situation were going to get transported over there with all their problems and all the crime and all their weapons and everything that goes along with it and all their stuff that they brought with them. And so they actually, we stopped in Dallas and we got to meet these guys. We actually got escorted by the Dallas SWAT team from Dallas to Houston and into Houston to the Astrodome, where they passed us off to the Texas Rangers, which is like the division of the Texas State Police, and had quite a security operation around the medical operation, around the relief operation. So we kind of rolled in around the same time that we arrived. There was a suggestion from the president that there'd be a federal takeover of the response effort in the city of New Orleans. It was declined. There was simultaneous movement of patients into the Astrodome complex and actually started overflowing. And so they opened the whole complex around the Astrodome called Reliance Center. That was sort of the moment that we arrived. So this is the Astrodome complex. The complex itself has like a convention center around it. Anybody been to Houston or anything around that? Yeah. So this is like a big area, and so the idea was take everybody from the New Orleans area, move them into here as temporary housing, reevaluate them, and then continue distributing them somewhere else. And so use this as like a temporary area. They could be there 3-5 days or something and keep them moving. It was actually right next to Six Flags. There were like water slides, and it was like scorching hot, ridiculous. It'd be really nice to go over and hang out in water slides, but everything was closed, of course. So we set up inside the complex here with the idea of taking these incoming people who are coming in on busloads mostly directly from the Superdome coming to the Astrodome. But as anybody who's been, we've got like military people, as anybody who's been involved in any sort of like government operation knows, it's basically hurry up and wait, right? And so we got there and then they're like, wait, hang around, wait. We know you've been rushing to get here, but we don't know exactly where to put you yet. There was a media circus. All these are the satellite trucks and stuff that are set up in the parking lot of the Astrodome. And it wasn't really until that night that they first came up with something for us to do. And so they came to us and they're like, okay, we have the plan. Our commanders had sort of been working with the local incident command staff and trying to come up with coordinating with the federal joint coordination center about what was going to happen. And so they came up with a plan. The goal is your mission, and you are going to triage every person coming into the state of Texas. Perfect. Easy. So your objectives are provide medical clearance for them. So have anybody coming in is going to come through the Astrodome complex. You get to clear them. You get to figure out whether they're okay for further transport somewhere else, and then we're going to move them out, or whether they need to be pulled off and have some medical intervention done, and then move them somewhere else or provide some kind of temporary care facility for them. So the initial arrival was 900 patients in the first 2 hours that we were set up. I need to frequently, I hadn't thought about it for a long time until I started like working to fill in on this talk and give this talk again. That, you know, anytime I'm thinking to myself, like, God, I just got 7 patients this hour, this is such bullshit in the ED. The 450 patients an hour is actually a pretty distant memory, but I think that I can handle the 7 patients. So we had a group of us that we split off into teams of about 6 people, and were responsible for each bus load that came in. And so started doing shift work the next day and split up into a day and night shift that was basically a continuous operation of like a law enforcement screening and then moving people through sort of some assessment and medical screening as they came off. So there was initially a group, this is kind of dark, there were initially groups of cars, private vehicles that came in. And eventually what we realized is that it was mostly going to be busloads of people that were coming in. It was public buses, school buses, charter buses, any sort of large vehicle that they could find, they borrowed or stole and moved people from the Superdome complex. So we set up sort of like this system that we don't have to, like the details aren't important, but like buses would come in and we had some options to like treat people and then some options to get people some supplies and food and water and stuff. So we use kind of this funnel system, we'll come back to this in a second. But this is like the general concept for triage, is find your people that are coming in, funnel them through one point, and then at that point have somebody triaging them, right? Like this is what we talk about when like when Stephanie Wise is doing EMS MCI kind of talks, right? So the idea is you have people who all need to get screened, but you have insufficient resources to take care of them all at once. That's the definition of a mass casualty incident, right? And so you have to funnel them through some point and then figure out who needs to, how to prioritize your resources. And it's completely fell apart. It doesn't work to see 900 patients. It works to see 40 patients, but not 900 patients. So initially, we had all of these Texas Rangers who were helping out by doing all the security screening for people when they came through. They'd come in spurts, as you might imagine. These buses would come as like a convoy of 2 or 3 or 4 buses. They'd start to unload. Everyone would get screened, and then we would try somehow to triage them to figure out who needed medical care. And there were a lot of interesting things that these Texas Rangers found. The people, when they were packing up to go, they kind of grabbed anything they could think of, screwdrivers and files and lots of knives and somebody's like chef box with like a giant chef's knife and like a big fork thing and somebody's whisk, like the Mike Simon influencer that has like a whisk tattooed on their arm. It's like a giant weapon. So people had all sorts of stuff that they were using to defend themselves, like combs and stuff that were filed down. It was really like total prison weapons, like improvised weapons. And so everybody had these weapons because everyone heard these rumors that people were getting killed over evacuation priority. And people would literally fight each other in order to get on a bus to get out. And they brought everything that they had with them. Captain Hook stuff. It was like pretty amazing stuff that they pulled out here. They would come in spurts, and so then there'd be these like episodic periods of boredom. And then you have another big group of people that would come through. When they did come through, we had opportunities to give them food and water and like diapers and stuff. Came up with like really rudimentary ways to keep track of people. There is like no tracking system that was designed for this. There still isn't, even 10 years later. Like nobody has figured out how to track large quantities of people coming out of stuff. You can see like we kind of like threw together this whiteboard. These are like the arrival times, like 9:40, 9:40, 9:40, 9:40, 11:15, 11:30, 0005, 05, 1:40. So they kind of come in like bursty little clusters and busloads of people. the Red Cross setup, there are actually 4 times as many community volunteers from the Houston area that like came out to help compared to the number of patients that actually arrived on buses. And so that was a whole separate issue of like, how do you manage like this outpouring of support from the community to figure out like who's credentialed to actually do stuff and what to do and like how do you manage them? And so that's a whole other issue that has since been actually developed even a little bit more than a lot of the other stuff in terms of disaster response. And that's why it's important now, if you're interested in this, if you're interested even not in deploying out of state, even just doing stuff locally, to get involved before the disaster. Because what most states have done now is set up like credentialing pools where you have like a registration with the state to figure out who's trained and who's ready and who's appropriately credentialed for disaster response. So the Red Cross was there. We had a bunch of other aid organizations and stuff that came through and gave people opportunities to somewhat replenish the food and water and stuff that they came with them. We actually have a veterinarian that deployed with us on the team. Vets are really useful, actually. So if you think about the WMD side of our response, and last year I gave this bioweapons talk, vets have seen a lot of anthrax, right? And so, because this is a zoonotic disease, a lot of these other sort of bioweapons are things that vets are really good at, that human doctors don't see. We're scared of it, right? And we're like, oh, that's a weapon of mass destruction. But for vets, it's normal everyday business. And so we have vets on the team because they have great expertise in this. But people brought along their pets. They weren't actually allowed to bring large animals, but some people smuggled small animals inside bags. And so we had like iguanas showing up and various stuff. And lots of little kids that showed up and had gone for a number of days like without appropriate food or water or anything. This was our ED that we set up. So this was for the initial group of people coming off the bus. People needed like emergency stabilizing care, and we had like a life pack over here and some oxygen and some basic stuff, but like really not a whole lot of stuff. We had a couple ambulances from Houston Fire that could take people to EDs if they needed like ICU admission. But otherwise, the plan was take care of them here and move them somewhere else, because the Houston EDs still had to take care of everyone from Houston, and had the additional influx of, over the course of a few days, 200,000 additional people that came into the city of Houston at this complex. And so there wasn't really an opportunity to move everybody who needed care to a healthcare facility, and that was part of the reason to bring in other teams to do this. So there were tons of cops, a small number of local EMS responders, and what we realized is we've got all this decontamination stuff. We've got like these big tents and showers and like all kinds of goodies to clean people off when they have exposure to chemical weapons. But why don't we've got a bunch of people coming in that have been sitting in sewage for like 4 days. So it took a really long time to figure out that we actually could handle that with showers. And so we ended up setting up all of our decon tents and gave people the opportunity to also get a shower when they came off the buses. People were generally displeased. There was still like a lot of vandalism and crime around the area of the whole complex. These buses, this one was the first hijacked bus that arrived. These other two were eventual arrivals of hijacks. These were people that banded together with their weapons. They were people that had larger weapons that would actually take over a city bus or take over a school bus and boot everybody off. And they literally drove around and rounded up their friends and their people and their family members that they wanted to evacuate with them. And they literally like forcibly evacuated the people that they wanted evacuated and pushed other people out of the way and fought for their lives for these buses. So we had people that came in that had been up to some nefarious stuff, but we ended up sort of segregating these buses elsewhere because the cops wanted to do further investigations and stuff, and they kind of kept them as evidence. So we ended up with like a parking lot of buses that were not the normal transport buses, but were the hijacked buses. The whole operation kind of continued day and night, day after day, and continued to string people in a really like bursty manner. They continued to have lots of problems with weapons and crime and stuff coming in. They made 53 arrests of people at the entry point the first day. Yeah,
For your little makeshift ED, did you have any volunteer doctors there, and how advanced were your workups? Like, were you guys doing EKGs, chest X-rays? What were you doing?
Yeah, so the stuff that comes with the DMAT, so that in terms of the staff, so we have, the team deploys with like at least 2 or 3 physicians, at least 4 mid-levels, and then a bunch of EMS providers. And so that group that's sort of used to working in an ED setting was available to staff that in different shifts. In terms of the equipment, we had, it's basically like the equipment that you find on an ambulance. So not a lot of radiology type stuff, but you could do EKGs and you could do like, start, basic meds, and you could, run a code or do sort of fluid resuscitation and kind of normal ALS ambulance stuff, sort of the general capability. We ended up, I'll show you in a minute, that we ended up with a sort of larger clinic operation also. So the rest of this outside stuff was happening in parallel with development inside the Astrodome. We eventually were able to move in a lot of this relief stuff so we could walk people inside because it was super hot outside. It's still the end of August. And so this is the outside of that ED. So that ED tent we eventually moved inside to get some kind of climate control once they're able to open up this area. So this is like the inside of the convention hall, or one of like the big rooms in the convention hall. What we realized is that these people that we'd seen kind of televised nationally fighting each other at the Superdome, these were all the people they really kind of funneled everybody officially and unofficially to Houston before distributing them elsewhere. And so there were just tons and tons of people that had been through incredible stories and were very interesting to talk to, and unfortunately didn't have the opportunity to talk in a lot of detail to a lot of these people just because there were so many of them. But when you did, they were really interesting stories. And people were entirely excited to just have one clean shirt that they were able to pick up, or a bottle of water that they were able to get after going for a number of days without anything. One of the FEMA people who was there felt like, just in terms of scale of the number of displaced people and the overall death toll, that it was really just no comparison to some major stuff. This is, Hurricane Andrew was the big storm before this, right? And so here's Katrina, both in terms of deaths and homes lost and cost. These are all adjusted $2005 all the way across here. So it's just no comparison. And same thing, now we think Sandy was such a big storm. In terms of the actual landfall, Sandy hit as a Category 1. This, fortunately, Katrina hit as a Category 3 and not a 5, as it was projected to be. But the death toll is nowhere close. The number of displaced persons is nowhere close. And the total monetary cost adjusted, these are, I think, now adjusted $2012 or $2013 or something like that. But still, this is still the biggest storm in U.S. history, and it was really big impact. What we figured out though was that everybody who was at the Superdome, who went into the Astrodome, still had all these care needs. And so eventually they realized that the same problems were recurring that happened. They'd set up sort of big sleeping areas, so we needed to come up with a way to provide care to all these people also. And they just went on and on and on. And so this is inside the main dome, and inside all the other little convention center facilities, people were kind of putting up signs looking for loved ones and kind of putting up lists of other places where people had gone, searching around for any hope of finding somebody that they knew, or some place to go after you're done with this temporary shelter. But we needed to come up with a way to triage all these people on a continuous basis, because they continue to have medical problems. All of these people came in with, it's a population very similar to Detroit. People came in with lots of comorbidities and needed their medications refilled, didn't have access to anything. And so we ended up creating some roving medical teams that consisted mostly of our EMS providers to kind of wander through here on a continuous basis and figure out what was going on with people. And so the question is how do you identify, out of hundreds of thousands of people across this whole complex, how do you identify who needs care? And this is different than setting up at a sporting event, a mass gathering where people will come to you and they might fall down the stairs because they're drunk, right? This is you have to go seek them out. And so there were lines, waiting for various forms of aid and registration of people. And so we've made these teams that were kind of agile to move around and triage people. And this is sort of the old model of triage for these, like the 40-person, 50-person, 200-person MCI train crash thing that we've learned, like start triage or various iterations on that. What one of our physician assistants came up with, and he's since published on this, is called gap triage. And so this is sort of the takeaway message that I think is the most applicable thing to what you can do going forward, is sort of mass triage for people. And what we've discovered, and there aren't like randomized trials of this, right? You just have a natural experiment. Like we tried some triage method, we tried some other triage method because there was a big disaster. But the idea was focus in on people that are geriatric, people who have apparently altered mental status, or pediatric patients, and go and assess them one-on-one. And let other people come to you. So we were able to set up with some of the Houston area physicians and nurses and kind of clinicians' offices, set up like a temporary sort of clinic area where some of the local providers, some of those volunteers could come and like write refills of prescriptions for people and kind of do minor acute care stuff, and had some dental stuff and some ophtho stuff. They actually used it for us, and so like everyone got updated on vaccines and stuff, because we were starting to see really interesting diseases. We had cholera, there were a couple cases of mumps, there was a case of measles, and there was concern that there was typhoid. That turned out not to actually be the case. There are definitely multiple laboratory confirmed cases of cholera, and then lots of just kind of like viral gastroenteritis type nasty illnesses. And so all this kind of generated a lot of trash. They had 12 tons of trash that they collected every day. So there's a huge sort of support operation that supported all of this. The work weeks were like 120-hour weeks for us, and so every time I'm worried about like the 80-hour work week and stuff, I need to think about that, being like so tired you fall asleep when you're sitting up. It ended up, this was a picture that was published in the Denver Post that was became sort of an interesting, like somewhat famous local picture. The all told sort of aftermath of this for disaster response, is still to be determined, right? There's a lot of reports and a lot of stuff, and a lot of changes that have been made, but there's still a lot of opportunity that we can participate in as healthcare providers and as emergency physicians in particular, to be able to respond to some of this stuff locally and nationally and internationally. I think that in general, I'm happy to answer whatever questions you guys have about this specifically. In general, if you want to get into this, we can help point you in the right direction for sort of the local resources. We have a DMAT in Michigan. I don't know that any of our folks here are actually involved in it right now. No, I mean, Holowecki was sort of thinking about it, but so there are definitely some options locally if you're interested in getting involved in this kind of stuff. All told, there were like 18 DMATs that deployed to Katrina. They've continued to deploy on a regular basis to various stuff around the country. They're available internationally in some cases. So lots of opportunities to get involved if you're interested. I think some lessons for even the situations where you have like the trauma code 3 or trauma code 2 times 3, to recess now, like a bunch of people come in all at once, and the surprise like drop off, multiple shot at people, they get pushed out of the car, and you get like multiple gunshot wounds and stuff. You guys are all nodding. Like these situations, those are all like triage situations, right? And so when we think of triage, we think of like a nurse sitting out front. But you actually need to, I think, be more well versed even than what we do as a department with triage, which I think is a very poor job of triage in general. We'll talk about that some other time. But the providers, you'll frequently find yourself like running out to ambulance, and you're like, I only have 3 spots in my recess room, and I've got 5 trauma codes right now. And so to be able to apply some of the lessons of disaster response and MCI response to the local ED is actually not very far away. It happens like every couple shifts, right? And so I think that you can take these lessons and take the experience that you get if you're interested in doing this kind of stuff and apply it to your everyday life also. Your everyday life also applies to this. So we'll stop and we'll go get lunch, but if you guys have any questions or any other stuff or want to talk more about this or get pointed in the right direction, let me know.